Hey everyone, this is Rami A Ballout. I'm a newly graduate medical student interested in pediatric metabolic disorders, particularly lysosomal storage diseases such as Gaucher disease. So as part of the International Gaucher Disease 2018 awareness campaign, I've been asked to prepare this video simply to explain why someone like myself is interested in pursuing the field. So to start with, during our clinical training years in medical school, we do not really get adequate exposure or training in the field of rare diseases, and even our supervisors themselves are often not trained enough in the field. Sometimes we're even discouraged from pursuing the field, sadly. And alternatively, we're encouraged to invest our efforts in pursuing the more common conditions, let's say cardiovascular diseases, infectious diseases, autoimmune disorders, or even cancers. Because rare diseases are simply rare and they affect only a minute fraction of our patients. However, I've come to realize that many people fear investing their time in rare diseases because they think that they're really complex to understand. At a time, they're really not. Oftentimes, the cause of a rare disease is a single cause, which in the case of Gaucher disease is a defective glucocerebrosidase. In contrast, the more common conditions, let's say cardiovascular diseases or cancers, are caused really by multifactorial etiologies, which can include several genes, lots of environmental factors that can factor into the development of the disease, the severity, or even the prognosis of that condition. So really, understanding rare diseases is not as complex as it may seem. Moreover, in recent years, the finding that Gaucher disease patients are at a higher risk to develop Parkinson's disease and have an earlier onset of the disease is quite intriguing. Similarly, the finding that certain Gaucher mutations increase the likelihood of the affected patients of having osteoporosis or osteoporotic-like conditions and multiple myeloma, which is a hematological malignancy that's really not that rare, is very interesting because this tells you that the same defect that underlies the development of Gaucher disease is also putting those patients at risk for developing Parkinson's disease, multiple myeloma, or osteoporosis, which means that this enzyme somehow factors into the pathogenesis of these more common conditions, and understanding Gaucher disease can be a key to the understanding and hopefully the development of treatment for those more common conditions. So really, rare disease is not necessarily an isolated disease, but it can be really the answer for the more common conditions. So as part of my future endeavors in the field of rare diseases, whether it's research endeavors or the clinical training, I'm launching my own motto to inspire future generations and other people to pursue the field. And it's actually inspired from my own initials, the R, the A, and the B. And it really describes how I feel about rare diseases, which is the following: rare and beautiful, because rare diseases are really rare and beautiful. And for that purpose, I've designed my own t-shirt to actually carry this motto and disseminate it to all the people out there. Rare and beautiful. Thank you very much.